Hi, this is Fred Hassan, and it's time for our daily video here at sitmeansit.com. All right, today's guest is Dr. Sidney Carter, D.C. What's D.C. stand for? Does that stand for District of Columbia? I was raised in that area, so that's the first thing that comes to my mind when I hear D.C.
No, in this case it stands for Doctor of Chiropractic. What my background is, I'm a human chiropractor by trade, and we got additional education with the American Veterinary Chiropractic Association, so I am registered with the Nevada State Veterinary Board. That being said, I can work on humans in the state of Nevada and also animals.
All right, Doc, so that leads me to my next logical question. What do the vets think about you?
Actually, I work with veterinarians on a daily basis. Prior to me evaluating the animal for the first time, I like to talk to the veterinarian on the phone or in person to know if there's any medications or prior x-rays or imaging that's been taken. I also like to have open lines of communication. Anytime I see the animal, I like to fax the notes over to the veterinarian so they know exactly what's going on with this animal.
Well, that's awesome that you work in conjunction with them. All right, now, I've never had any chiropractic care for my animals, but they swim a lot, they jump, they're working dogs. How would I know that they need chiropractic care?
The first thing you'll notice that any sort of decrease in performance, that's the major complaint I get from my performance or working animals. The other thing is if we have any sort of pain behaviors or any sort of injuries that we need to get the animal moving properly again. Any sort of decrease in biomechanics or gait can lead to a condition that will lead to the necessity of chiropractic care.
All right, Doc, so when I bring my dog to you, is this like when I go to a regular chiropractor and I got to spend like 2 hours filling out forms? Does my dog have to fill out any forms?
Well, if your dog can fill out forms, I will let him fill out forms, but on average it's only 1 to 2 pages of paperwork you have to fill out.
Oh, that ain't too bad. So what all does this chiropractic care for him entail?
Well, what we're going to do is first off, we'll look at his past history, seeing what the veterinarian's already done, find out any sort of past medications or imaging or x-rays that we've done. We'll do a gait analysis. That means we're going to watch him walk around, see how well he uses those muscles, and then we'll do some chiropractic care on him if indicated. And on average with chiropractic care, what we do is restore normal range of motion to the joint level with some manipulation or some slight impulse to those joints.
So how long does this take to work? So like if we have a real lazy dog, we can just bring him into you and you'll turn him into Superman in 2 minutes? Or
on average, we'd like to see results in office. So we like to do the adjustments. We like to see them working fairly quickly within 1 to 3 minutes of the adjustment. Sometimes they can take longer than that. If we've got some neurological compromise, it might take as long as 1 to 3 weeks, but on average we see them in office the day of the treatment. And that should be pretty easy because obviously the client knows its dog pretty well and they should be able to notice that. Hopefully they notice it right away, and hopefully the comments I get most often are, oh, that's how he's supposed to be moving. That's what makes my day enjoyable.
All right, doctor, so a lot of our viewers out there, they like to see things and see how this works. Do you have anything on your website that can show you in action?
I actually do have some demonstration of me adjusting animals on my website at LasVegasAnimalChiro.com.
All right, so we've got you here every third Monday, roughly, here at our Las Vegas facility.
Correct.
So those of you out there listening want to make an appointment, come on down. And if you want to see Dr. Carter in action, just see LasVegasAnimalChiro.com. And thanks for your time.
Thank you very much.
Hi, this is Fred Hassan, and it's time for our daily video here at sitmeansit.com.